Bill Bowtell, are we dealing with this urgently enough?
No, we're not. And I think at the outset we've got to differentiate between what's happening in Victoria and New South Wales and what's happening in the other states of Australia and New Zealand. If you take Australia and New Zealand together, about 30 million people. Now tonight, more than half of that number are living in COVID-free jurisdictions because they saw the problem for what it was, and one way or another they've got to a situation where they've eliminated community transmission. So we're not talking about an Australia-wide problem, we're talking about a problem that's emerged in Victoria and in New South Wales, where the strategic decision was not taken, as it was in the outlying states in New Zealand, to eliminate local transmission. Now the virus will find the weakest link, and because we didn't have that strategic goal, the virus has found a way to come back. We were too quick to come out of the lockdown, the first one. We did not advocate strongly enough the use of masks in the transition, and here we are. It's a very serious situation in Victoria, and I hope not as serious in New South Wales, but we cannot keep on doing this. We have to stop this thing here and now.
Just to be clear, is it getting away from us in your view?
Well, at 350 cases a day, yes it is. 350 cases a day, 2,000 a week. That means there's a proportion of those cases who are people now who are very ill, who may be requiring hospitalisation, and a proportion of those who are seriously ill. Now, that imposes immense strains on our healthcare workers, from ambulance drivers all the way through to the doctors, the nurses, the hospital staff, and so on, and by implication their families. So this is not a good situation, and it's good to see that the Premier, the Prime Minister, all the resources, the money, the intellectual effort, the facilities are going to knock this down. So that's good, that's tremendous, and we've all got to get behind that and bring it down. The question is though, do we bring it down to the same low level we had a few weeks ago in Victoria and New South Wales, and then go into another cycle of rinse and repeat and have a lockdown 3 come at Christmas? I'd rather this Christmas was COVID-free in New South Wales and Victoria, like we hope it will be and remain to be so in the rest of the country and New Zealand. We have a choice now in front of us. The experiment's been run in real time from March through till August now, and we know what works and we know what doesn't work so well. So let's get on with it and let's just knock this thing out. The evidence is overwhelmingly clear. The debate, in my view, is finished. We've just got to get on with the job of doing in New South Wales and Victoria what has been done in the outlying states in New Zealand. Where would you rather be tonight if you're in a job in a restaurant owner in Melbourne? Would you rather be opening up tomorrow in Melbourne or in Auckland? Where would the customers of that restaurant rather be? In Melbourne or in Auckland? I think they'd rather be in a COVID-free environment. I mean, the virus doesn't obey Australian political rules. It isn't a nice virus. It obeys the laws of physics, chemistry and biology. It finds the weakest link, as it did in Victoria. Hopefully it won't in New South Wales, but it could at any time. And if we're prepared to kid ourselves that there is some stable level of coronavirus able to be maintained for the foreseeable future, well, that's just not borne out by any evidence or facts. The virus is either going up or it's going down and hopefully out. They're the two choices. We know what to do now after 4 or 5 months of experience to knock it out in Australia and New Zealand. It's not pie in the sky. Knocking it out would make the life of people who run businesses a lot more predictable, a lot better, and we would see the sort of recovery that we're seeing now in New Zealand that's taking place in Western Australia and in where Simon Birmingham is from, in Adelaide, Wales and Victoria.
Could we
all
do
of these other things are just process
you're talking about
that
elimination again. Can we actually achieve
Well, for 3 weeks between May and June, the dates, New South Wales had 0 community transmission. I don't understand why people think this is some pie-in-the-sky objective. New South Wales, with a very strong public health response to its very great credit, has had 3 to 4 weeks
What
of
would
no
we have to
community
do?
transmission.
To get there, what would we have to do?
I think we will have to look very seriously at all the measures required to lock down for the last time, not to repeat this cycle of the Groundhog Day cycle, if you like. We know that it works. We know that it's worked in Western Australia, where they haven't had community transmission since the 12th of April. And I think really the Australian people, when they went down into the first lockdown, really thought that they were doing what New Zealand was doing. They were making the sacrifice. It was the commitment and solidarity of the Australian people at that time that drove community transmission down to extremely low rates. The question we have to ask is, why at that time was the government not bold enough, ambitious enough to transform that achievement into a permanent situation, as happened in New Zealand and in the outlying states?